Hello everybody, my name is Manuel Garcia. This video is my gender-based medicine assignment, and the purpose of this video is to discuss challenges and issues that are facing medical personnel regarding gender and sex in today's society and today's medical practices. My target audience will be other radiology technologists that work in the field. I'm going to start off with the differences between sex and gender. Sex is a biological issue. You are either born male or female with male or female reproductive organs. That is what's going to define you as your sex. Now, gender, on the other hand, is how one person identifies in today's society. You may be born male or female, and you may identify as the opposite sex. If you're born male, you may identify as female, and this would define your gender. Okay. Some important differences in the sexes that and in sex habits when dealing with medical health care is many times it is women are more prone to heart attacks or heart disease, but it's the men that actually have issues like chest pain, and they get reported more, whereas women will die more from heart disease that goes untreated because they don't have the typical pains like chest pains that men do. So they go untreated. Other issues that biologically affect differently men and women are how prescription medications or just medications in general are metabolized by the body. Some medications are metabolized quicker in women, so they have to take a little bit more. Some are metabolized a little bit slower, so they need to take less. But what you do find today is a lot of times on medication bottles, it's not prescribed as adult male or adult female. It's prescribed as adult, take this many tablets. Children under this age taking this many tablets. So there is some disparities in how pills and medications are affect men and women. Also, the other thing that's not known is more women have more adverse reactions percentage-wise than men do to prescriptions. But this is not identified because most prescriptions and most medicines are not tested equally on men and women. They're more predominantly tested on men. Some other issues that we'll face in today's medical climate is issues with gender identity. You will have patients that will identify as male or female when they're actually sexually the opposite sex. Okay, and this can cause some disparities in treatment because many times, for one thing, most transgender people are a little bit leery about seeking medical treatment because of their identity, how they actually identify with their gender. A lot of them feel like they may be ostracized or, made fun of, so they tend not to seek medical care on the same as men and women that identify as men and women because that is their sex. Couple things that can be an issue when you have gender identity issues is getting the proper tests, getting the proper diagnosis and exams done that you need. Other issues that you may face is some discrimination when you go to facilities. Some people may, because of their beliefs, tend not to treat you the way they would a normal person, or I shouldn't say normal because that's being discriminatory, but they may treat you a little bit differently than, say, a man who identifies as a man, when you are a woman who identifies as a man. And, they might treat you a little bit differently. They may not do some of the things that they would normally do when doing their exams, which could compromise your results. Okay. Some of the issues we face today are lack of training when it concerns gender transgender issues, or people that might not identify as any gender. They might identify as both genders. Okay, getting them the right treatment is our main goal. And there are some issues that we will go through today. I will go through a couple scenarios, one good, one bad, and how these can actually affect how a patient is treated, and whether or not we get the best results for their um, health issues that they are there visiting us for that day. And to help me do that, I'm going to introduce you to Tammy and Tommy. They will be my role players today. Okay. Tammy's going to be my radiology director. Tommy's going to be my x-ray tech. Okay. So here's the situation. Tommy has a patient that comes in that is a female to male transgender patient and needs a chest x-ray. And the patient is basically wearing normal clothes, Levi's, t-shirt, hat, glasses. So Tommy really doesn't have him change. Okay. So Tommy comes, and what the issue is on the chest x-ray, you see a really thick, heavy banding across the patient's chest, and it causes some artifact on the image itself, and the radiologist requests the patient to come back for another chest x-ray. Tommy researches a little bit and has some difficulty finding out that when he finds out that the patient is actually a female to male transgender patient, and now he has issues with it and does not know how to handle it. So he goes into Tammy's office. Hello, Tammy. Hey, Tommy, how you doing today? I'm doing pretty good. Workload's kind of slow, but I have an issue. I had a patient today that actually came in, and I did a chest x-ray on him. Well, on his requisition, the patient was identified as a male. He even had a name. His name was John Doe. So I did the x-ray as normal, shot his x-ray, turned it in. Okay. On the x-ray at first, I did see a little bit of artifact in the chest area, but didn't bother to ask what it was. Okay, Tommy, so tell me your situation. Well, the radiologist is asking that the patient come back to have another chest x-ray repeated because of that artifact on there. And what it looks like is there's some kind of thick clothing under there. Okay, so I researched it and found out that this is a female to male patient. And it's kind of got me a little bit weirded out because I don't know how to handle it. I saw the artifact on the x-ray, but I didn't bother to ask what it was because I didn't think anything of it. So now that that's happened, I'm going to have to irradiate this patient again, and I don't know how to handle it. I feel a little bit uncomfortable on how to ask the patient to take that banding off. Well, Tommy, here's what you can do. You could just tell the patient that our standard procedure for chest x-rays is that we have the patient change into a gown and take everything from the waist up off. That will actually include anything, including bras, necklaces, earrings, t-shirt, give them a gown to change into, and then you don't even have to express why they need to take the banding off. If they do happen to ask why they have to have this chest x-ray repeated again, you can just simply tell them that there was some extra clothing that caused some artifact. And whenever something like that happens, it can cause some disparities in how the x-rays are read out, which can cause some disparities in the reading, which can change how how their outcome is delivered or how they are actually treated from that point. Well, Tammy, thank you for the information and thank you for the guidance. I think I will do that. And I think I will make that a standard practice from now on, that I just change everybody, regardless of male or female, into a gown. And that will be my standard protocol for the day. Okay, Tommy, thank you. I hope that helped you. It did. Thank you very much. Bye. So I'm not crazy because I'm playing with dolls. I'm just using these to push a point. Now, the issue with Tommy and his patient was he saw the breast banding, which many female to male transgendered use to actually compress their breast to make it look like chest tissue instead of breast tissue. And these thick bandings they're pretty thick and pretty tight, so they actually hold the breast down. So they can cause some artifact on a chest X-ray. So when you do see something like that, instead of having to repeat the patient, a best practices would probably be to just make it a standard protocol that all chest X-ray patients, regardless of male or female, will be changed out of everything from the waist up and put into a gown. This will actually help your techs to better deliver medical care, because not only that, it'll help them be a little bit more comfortable because they don't really have to ask then whether or not they're male or female. Okay. As far as other x-rays go, you still have to protect breast tissue on female to male transgender patients, because they do still have the breast tissue that can be irradiated. So that's a different issue, but there are other ways that you can actually protocol for that as far as dealing with patients on a day-to-day basis. So a couple ways to actually improve on dealing with patients that have gender issues, that are transgender, male to female, female to male. There used to be a thing called universal precautions in medical field, and there still is. You treat everybody as if their blood is infected with something, so you wear gloves. You make precautions. You take the precautions as not to be poked with needles, not to get blood on your bare skin. So maybe this is something that we can do in radiology today. You take universal precautions in shielding genitalia, male and female, if it doesn't get in the way of taking a good X-ray. Treat everybody the same. If you're doing a KUB, whether they're male or female, change them into a gown. These are some things that can go into practice and can make things a little bit better, and make techs a little bit more comfortable. Other things that can be done in the department is you can have yearly training, sensitivity training, where you can do role playing, acting out different scenarios, and what you may come across on a daily basis, or even scenarios that you have come across on a daily basis. And you can actually enact how you treated them. And if it wasn't the best way to treat a patient, then as a group or collective, you can actually figure out how and what would be the best way to treat something or that situation. And then you can make that a protocol for the department. A couple other things that are going on in medicine is like gender-based medicine, LTC, which is medical school students are getting more training on how to be gender sensitive to patients, and how to treat transgender patients, because there are difference in treating transgender patients. Many people don't know that by law you cannot deny a male to female transgender person a mammogram if they've already started taking hormone therapy, because hormone therapy actually will produce breast tissue that can actually put them at risk for breast cancer. So there are laws out there that are on the books, and one way to actually deal with, to better run your department and handle situations like this is to be familiar with these laws, be familiar with these issues, and deal with them that way. So that is my presentation, and I hope it helps you out. Thank you.